I'm Heather Trescott. I'm one of the certified child specialists at Children's Hospital of Navicent Health, and I work in CHOPS. So CHOPS stands for Children's Hospital Outpatient Procedural Services. Basically, we do sedation for minor procedures such as colonoscopies, endoscopies, MRIs, LPs, bone marrow aspirations, INDs, all kind of stuff. So we're kind of like a one-stop shop for those kids that they may be coming to the hospital, from home and for a quick procedure and then leaving that same day, or it may be some of our kids that have already been admitted and during their stay they may need a procedure, so our unit kind of does the sedation for those. And then also we have a ton of chronic patients that come for infusions, whether they have cancer or Crohn's or sickle cell, and we'll do Remicade infusions and blood transfusions while they're here with us.
Child life therapist, we have Heather, and she is probably the most important part of our job. She prepares the children for their procedures. They come in very upset and scared. Heather is very prepared for any situation. She is like a magician sometimes. She has toys or tools that are hidden in her pockets, or she has easy access to everything that we need, and she can distract a patient and they don't even know that you're getting ready to do an IV, or they're not, they're more focused on blowing bubbles than they are what you're actually doing to them.
We have a variety of distraction toys that we can use, so whether it's it's a little toddler that wants to play with this little light up turtle that can light up and play music, or we use this all the time for our babies, a little mirror that they can look in and play with. And then our bigger kids may do anything from looking at an I-Spy book to playing on the iPad and playing a game with us. So when a child comes up to us, the first thing I do is just go in there and meet them and try to give them something fun to do to make them comfortable. A lot of times they're really scared. They may not know why they're here. They're terrified of getting a shot or whatever it may be. And so I'll go in, give them Play-Doh, give them some paint, a movie, just something to kind of put them at ease and play with them for a little bit. And then once they're comfortable, I'll go in and kind of assess what they think is going to happen today, and then go in and kind of prepare them for what is going to happen. When a child comes to us for a procedure, we have to do an IV for their sedation. So when they do that, I prep them with usually a stuffed animal, so that way they can kind of see what the IV looks like. They may have never had one before, or maybe they did and it was a bad experience. So I kind of go through it step by step with them and show them exactly what it's going to look like. So I'll show them everything from the tourniquet to the syringe. We'll actually put the IV in the stuffed animal so that they can see it go in and learn that the needle does come out. A lot of kids think that needle, is stuck in their arm the whole time, so you'll see them, like holding so still, afraid it's going to poke them again. So we just try to clear up those kind of misconceptions. And one of my patients, Jacayla, she comes to me every other week and has to get an IV every time. So what we'll do is we'll bring in a stuffed animal or a doll and let her give the IV, and we'll help her do step by step, putting the tape on, putting the tourniquet on, and just kind of give her some control. Instead of constantly having IVs given to her, she can kind of be the doctor, be the nurse for a minute.
My name is Jacayla, and I just showed y'all how to do an IV.
Being a child specialist, because kids come up here and sometimes they're so scared they'll barely walk down the hallway to us, and then after we do all of our interventions with them and play with them and get them comfortable, a lot of kids will say, "I don't want to leave, I'm having too much fun." So it's just wonderful to see how what could have been such a negative, traumatizing experience turn into a positive one. And then hopefully if they ever had to have any future medical procedures, they won't be so scared the next time.